How can I find a stem cell donor for sickle cell disease? Finding a stem cell donor for sickle cell disease involves a careful process focused on matching human leukocyte antigen markers. The most ideal donor is a fully HLA-matched sibling who does not have sickle cell disease. There is about a 25% chance that a sibling will be a perfect match because they inherit HLA markers from their parents. It's important to note that the sibling might carry sickle cell trait but not the disease itself. Blood type and gender are not necessary for matching, only the HLA type. The process usually starts with testing the HLA markers of the patient's full siblings. If a matching sibling is found, they can be considered as a donor. If no match exists within the family, the search expands to national and international donor registries. These registries, such as Be the Match or Anthony Nolan, keep lists of potential donors worldwide. Donors in these registries are typed for HLA markers, and the best match is sought based on compatibility. If neither a matched sibling nor an unrelated donor is available, alternative options may be considered. These include using umbilical cord blood units or haploidentical donors who are half-matched family members. These options are still under research and may carry higher risks, so they are carefully evaluated by medical teams. Stem cell donation can be done in two main ways. One is peripheral blood stem cell collection, which involves giving medication to mobilize stem cells into the bloodstream, then collecting them through a process similar to blood donation. The other is bone marrow donation, which is a surgical procedure performed under anesthesia to extract marrow from the hip bone. The choice depends on the patient's health and the medical team's recommendation. Because finding a fully matched donor is challenging, less than 1% of patients have a fully matched sibling, many relying on unrelated donor registries. It is especially important to increase donor diversity, as HLA types are inherited and vary across different ethnic groups. Patients of African descent, who are often affected by sickle cell disease, may find it harder to find a match due to lower representation in registries. If you are considering a stem cell transplant, it's essential to speak with your healthcare provider. They can help coordinate HL testing and guide you through the donor search process. They will also evaluate whether you are a good candidate for transplant, which is usually recommended for patients with severe complications of sickle cell disease that are not well controlled by other treatments. In summary, finding a stem cell donor involves starting with HLA testing of siblings, then searching national and international registries if no match is found. Alternative donor sources like cord blood or half-matched family members may be options. Working closely with your medical team is key to exploring this potentially curative treatment option. Remember, each person's situation is unique, so personalized medical advice is essential.